So I've just come back from giving the Shepard Lecture at the Centers for Disease Control in Atlanta in the United States. This was a named lecture after Dr. Shepard, who discovered how to culture leprosy bacilli, and it happens at their prize-giving ceremony. And I chose to talk about global vaccination and the role that vaccination has played in improving health, because this is an opportune time. We are entering the decade of vaccination set by Mr. Gates, and today there is a meeting in London to see if money can be raised to help vaccination in poor countries. And during my lecture I pointed out that the enormous advances that have been made through vaccination, even in my career since I first went to work in Africa, for example in getting rid of smallpox, really controlling measles, and perhaps very nearly getting rid of polio. But I also pointed out that we needed to be sure that the new vaccines that are coming along, like the pneumococcal vaccine and the vaccine against rotavirus diarrhea, get to those people who need them most, who are generally the people living in the poorest parts of the world and those that are least easy to get to. And finally, of course, we have the potential for developing vaccines for preventing many other infectious diseases, the big three, TB, malaria, and HIV. But there are also many other infectious diseases that are important in selected parts of the world that could be prevented through vaccination. And we need to continue to invest in making those vaccines and getting them used.